located on the same site as St George's Hospital. St George's is a major hospital in South London. It provides care across South London and sort of the southeast and bits of the southwest. It's a hospital that you might see on TV, so 24 Hours in A&E is filmed in our accident and emergency department. And this really builds on the ethos of what our university does and why it's a little bit different. So a lot of our professors, a lot of our teaching staff are active clinicians. So that means they're working in the hospital, they're working for the NHS in their designated role, and they're spending a bit of their time teaching you. It means you're sort of integrated into that care system from day one. Despite that, we're still part of a wider university. So we have a students' union, you can get involved in sort of sports activities, we have a gym, we have accommodation, all those typical things you would expect to see at a university. It's just that we have that focus on healthcare and science, and so we're able to share this site with St George's Hospital. One thing that's also worth knowing is we actually just merged with another university, with City University, which is based in Clerkenwell and Moorgate in central London. This won't affect you too much if you're applying to one of our courses, but it will give you extra opportunities to get involved in wider students' union stuff. So you can do things in central London with the SU now, and also get involved with some of the resources that City have in the libraries and maybe even some of their clinical placements down the line. So St George's courses can be split into three different types. We have our two science courses, biomedical science and clinical pharmacology. We call these science courses, not because the other courses aren't scientific, but because these aren't placement-based courses. So all the purple and the red course that you can see, you'll spend a bit of time in the university and a bit of time working in various care centres and hospitals, honing your skills that way. Whereas for biomedical science and clinical pharmacology, it's all sort of based at university, maybe with some placements out and about. As you can see, we've got quite a diverse set of courses, even within our healthcare, medicine and science courses. You can study everything from physiotherapy to paramedic science. We're not going to go through all of these in detail, partly because it seems like a lot of you already know what the courses are about. Also, we have a series of webinars coming up that explore each of these courses in a little bit more detail. But most importantly, we don't really have enough time to go through each course individually and why it's great. Instead, we'll focus on a few key examples before moving on to that sort of admissions piece a little bit later on. As well as these undergraduate courses, we also do have some extra stuff that we offer at St George's for people who might already have a degree. So we have a Physician Associate Studies course. We offer medicine specifically for graduates. We also have some postgraduate courses in genomics, a bunch of other stuff. And we work really, really closely with our colleagues at City University, where they offer nursing, midwifery, optometry, and other sort of health-related courses. So just to talk about medicine in a little bit more detail, because I know quite a lot of you are interested in that, and then we'll talk about sort of the other healthcare courses just a little bit afterwards. So generally, the undergraduate medicine course at George's is a 5-year course. The first 2 years are based more in the university. You'll still get to do a few placements here and there, but generally that's when you're skilling up on site at the university before you start transitioning into doing more and more placements. I'm not going to go over this in loads of detail because we've got John and Vicky here who can talk about it a little bit later on. But just so you've got a bit of an idea, it's generally a 5-year course with an optional year out where you can study a related subject. It's called an intercalation year. And after that, you'll go and probably work for the NHS and start your foundation training. Again, I'm not going to go over our sort of week in the life in loads of detail because John and Vicky will be a lot better at that than me. But here's sort of what a typical week for a medic might look like in first year at St George's. So you might be doing some anatomy to learn sort of the science behind the work that you'll later do in hospitals. We also have some clinical skills and communication skills workshops. So with communication skills, that can be about building up your relationships with patients. We sometimes even have actors coming in, so you can practice that and before you go out into the community or into a hospital, you're working directly with patients. On Wednesdays, that's where we often do our case-based learning. Again, I'll let the student ambassadors talk about this a little bit later on, but it's quite a unique way of building up your knowledge of sort of medicine before you go into a little bit more detail during your placements. And then Tuesday, Thursday, and Friday is often when we'll have our lectures, and these aren't often too big, so maybe a couple of hundred people, if that, in your lecture room, and that'll be on a really, really wide range of subjects, again, so that you have that underlying knowledge, so that you can go into hospitals and act as a trainee during your placement later on. In terms of our healthcare courses, again, we have a really, really diverse set of courses here. These are all quite unique, so again, I don't want to go into too much detail on any of them because then we won't have time to talk about the admissions process. But what I would say is each of them can be a really, really unique and rewarding career as well as a course itself. So some of the reasons that people might pick healthcare courses, why they might pick them instead of medicine in certain cases, is they allow international registration. So after you've qualified at St George's, you're able to travel basically wherever you want and use these skills in hospitals around the world. So if you're a healthcare scientist, you might become a cardiac physiologist, and then you can use those skills sort of wherever you might travel to. We have some really, really great facilities on site. Again, because we're sort of joined with the hospital, we're able to work really, really closely with them and make sure that we have really great clinical skills. And also a lot of our facilities have been updated really recently. We got a little bit of funding so that we're able to make sure that all of our facilities are really top notch for our various students studying different healthcare courses. One thing that's nice about studying a healthcare course generally, and especially at St George's, is you essentially have guaranteed graduate employment. The NHS is never going to run out of needs for radiotherapists, for physios, for paramedics, and so you're able to basically guarantee that you'll be able to walk into a job as soon as you've left, provided that you've done well on your course. And that can be a really, really positive thing, especially in the moment getting graduate jobs can be really difficult. If you do one of these healthcare courses, you're essentially guaranteed a job. One thing that is nice with all the healthcare courses is you're not stuck in university the whole time. It's not the kind of course that you'll be constantly writing essays and doing coursework. Instead, you've got that placement to break it up and to learn sort of on the job as you're doing it. Also, the healthcare courses generally open up a wider variety of careers than you might expect. So if you study physiotherapy, you could go work for the NHS and do physiotherapy in the community or in a hospital. There's also options to do things like work for a sports club. So one of our academics, Sanchez, he's a physio academic. He studied at St George's. He still teaches here, but he also spends a little bit of time working at Crystal Palace, the football club, as a football physio, sort of helping their players, working on fitness for the players. And so there is a really, really diverse set of careers that you can do afterwards. It's not necessary that you'll be working in a hospital or working in the NHS, but actually you can do loads of stuff after graduating from one of our healthcare courses. So I'll put biomed in a little bit more detail. Again, John can talk about this a little bit more. One thing that's really unique, again, about our biomed course, because we're based on the same site as a hospital, you are really, really getting to work closely with medical professionals. It's not like it's going to be completely separate from the actual day-to-day work of medical professionals. We offer a 4-year or a 3-year biomed course. If you do the 3-year course, you can transition into the 4-year, so it doesn't matter too much what you initially apply for. We're really, really big on making sure everyone gets the option to do some professional experience. So we have summer placements. We also have a professional training year, so you can take a full year out and go work in a lab or in another sort of professional environment so that you've got that work experience as soon as you graduate. We also are really, really big on making sure that we're supporting our students not just to learn, but also to achieve the best outcomes possible after they graduate. So our career advice is embedded throughout. You're consistently networking, making connections, and finding out how you can use your biomedical degree down the line. On top of that, lots of our students do end up applying for medicine as well. So if you decide to biomed and then you want to go into medicine afterwards, it can be a really great route that, as you heard earlier, both Vicky and John took. Clinical pharmacology, I just want to talk about in a little bit more detail before we moved on to the application process. Just it's really, really important that you sort of understand this. Clinical pharmacology is a really unique course. St George's, I think, is still the only university that offers clinical pharmacology, and it's a little bit different than pharmacy and from some other pharmacology courses that you may have seen. Instead, it's specifically about how prescription drugs relate to humans and how they can be used in clinical environments. So if you study a normal pharmacology degree, you learn a little bit about drug development and about how drugs can be effective or not. If you do a pharmacy degree, you learn how to administer drugs safely. Clinical pharmacology is that missing gap in the middle. It's figuring out, okay, this drug works, it really helps this thing, that's been proven. How do we make sure it integrates into a wider care plan? And how do we work with clinicians to make sure that is really, really effective for patients? This means that our graduates from clinical pharmacology are really highly sought after. They've got this really unique set of skills. It combines healthcare and science with some more sort of business focus, because again, you're thinking more widely about how these can be integrated into the wider NHS and healthcare environment in the UK and beyond. It's designed with employers in mind, so unlike some other courses, it's really, really focused on making sure you'll be able to slot into industry and get a really great job as soon as you graduate. The best sort of clinical pharmacology students I see are the ones that are really passionate about science, very interested in healthcare. They don't necessarily want to go into actual active healthcare, but still want to be involved in helping patients and using their science background to be able to do that. Be a really interesting course that not everyone necessarily thinks about at this stage, but if you are sort of interested in the science side, not maybe so much on the sort of clinical side, it can be a really great way of combining that and sort of moving forward with your course. So next, just talk a little bit more about the application process for Georges in a bit more detail. We're going to talk about a few different things, so our work experience requirement or lack thereof, what we sort of expect in personal statements, and also a little bit about how we interview for courses, specifically MMIs, which hopefully some of you have heard about. This should hopefully be relevant if you're planning to apply this cycle, so in October this year or January next, or you're still a couple of years behind figuring out your next steps. So the first thing to talk about is just our overall entry criteria. Now our entry criteria does vary year on year, so do make sure you have a little look on our website so that everything's up to date. Generally, our grade requirements are 3 A's for medicine, 3 B's for science subjects, so again that's biomed and clinical pharmacology, and then sort of varied for our healthcare subjects, so it can go from ABB for physio down to BBC for radiotherapy and oncology. Generally, we hope that people will study some science subjects, but it's not required for all of our courses, especially some of our healthcare courses. For medicine, you have to set an admissions test. It's called the UCAT. We're not going to talk about that in loads of detail, just because most of you will have either sat it already, or it will still be a little bit down the line, and we'll have more support for UCAT later in the cycle. But we will talk about our interviews. Now, we interview for medicine and for our healthcare subjects. Generally, we use a thing called an MMI, so that's multiple mini interviews. This is a way of testing a bunch of different skills back to back in a sort of approachable thing, and we'll go into that a little bit later on. For some of our healthcare subjects, we do still do interviews over the phone, just where these are a little bit more appropriate. You can find out if your subject has an MMI, a phone interview or nothing, if you have a little look on our website. We do accept other types of qualifications, so we accept BTECs for most subjects. We all accept T-levels for several subjects, and we generally accept most international qualifications. So do, again, have a little look on the website or submit a question at the end, and we can have a look and see if you might be eligible for some of our courses. One thing that I like to mention during every talk is we do have a contextual admissions offer. So if you meet our contextual admissions criteria, so that can be if you're care experienced, it can be if you're from a school that doesn't generally have high progression to higher education, it can be if you grew up in an area that doesn't have progression to higher education, you might be eligible for a lower offer. So for people that satisfy our contextual admissions criteria, the grade can drop by 2 A-level grades. So that means for medicine, instead of needing 3 A's at A-level, you would only need a BB. If you want to learn a little bit more and see if you're eligible for our contextual offers, do have a look on our website. The link is here, and I'll put it in the chat at the end, so you can find out if you might get a slightly lower offer based on your circumstances. Okay, so on to the bulk of today's session. What I want to talk about is the overall application process. Now, we are going to talk sort of generally, so we're not going to address specifically medicine or healthcare or science, but everything I'm going to say is relevant to all of the subjects. So it's really, really important that you sort of pay attention and then ask any specific questions for your subjects towards the end. So the first thing that I want to talk about is our work experience requirement. So as many of you know, before COVID, lots of universities required students to have work experience before they applied for medicine or healthcare related subjects. We've got rid of that, and we got rid of it during COVID and it hasn't come back. However, that doesn't mean that we don't still expect people to have some alternative to work experience if they weren't able to get that in-person, really, really relevant experience during sixth form. When we were reviewing this, the thing that we thought to ourselves is, why do we want people to have work experience? What do people get out of it that we think is really, really important to have before you join university? And it was mainly that we want people to understand the careers that they're getting themselves into. Our courses are engaging, they're interesting, but they can be really, really difficult. It's not for everyone to study a healthcare course or to study medicine. So we want to make sure that people have a really strong idea of what they're getting themselves into before they apply and before they join our courses. There are different ways to do this, however. If you can get in-person work experience at a local hospital, at a GP surgery, it is the best thing that you can do. However, we know that isn't possible for lots of people. If you're international, if you're in an area that just isn't really offering it, or if for whatever reason you've just not been able to secure that work experience, there are some really, really great alternatives. So some really good online work experience. The Royal College of GPs offers a work experience called Observe GP. This is great if you're thinking of applying for medicine to learn a little bit more about the role of GP in the wider sort of NHS and also how GP surgeries actually work. But even if you're applying for another healthcare course like paramedics, like radiotherapy and oncology, again, just understanding a little bit more of how the clinical environment works, the kind of patients you might be dealing with, and some of the things that GPs and the wider GP surgery staff consider. I would really recommend you all do Observe GP. Now, with any online work experience, it's obviously going to be a little bit less unique than if you had an in-person work experience, and that's why it's more important than ever to reflect on what you learn and to join it up with sort of wider reading or wider stuff that you've done around understanding the course and the career. So you might read some books written by current NHS staff. So I've got two examples here. One is called Life, Death and Biscuits. This is about a critical care nurse who actually worked at St George's Hospital. I've met her, she still works in the hospital, and about her career in the NHS and how it was affected during COVID, working as a critical care nurse. Can You Hear Me by Jake Jones is about a paramedic, again, working in the NHS, sort of understanding what the role of a paramedic is. Now, reading this sort of stuff or understanding different people's accounts of working in the NHS, working in the relevant careers will give you a really, really strong understanding of sort of how the career and course is put together, and it's something that you can then reflect on in your personal statement and in your interview. The last thing that we'd really recommend in lieu of having clinical work experience is volunteering. A big reason that we want to make sure that people have work experience or something similar is so that we know that you can communicate with people in sometimes difficult situations. And you can do that through non-clinical volunteering. That could be working in a charity shop. It could be working volunteering with like St John's Ambulance. It could be a really, really wide variety of volunteering opportunities. But again, it's how you reflect on that, how you understand it interacts with the course and the career that you're interested in getting into. It's making sure that you combine everything that you've done, your online work experience, anything that you've read, and any volunteering that you've taken to better understand the career and the course that you're getting into and how you'll be really, really effective in succeeding on that course. So to talk a little bit more about how to use this experience, whether this is in your personal statement, which I know some of you might have already written, or in your interview, which again, lots of you might have a little bit down the line. So the first thing that you want to think about when you're considering the course that you're applying for is what sort of skills do you need? So if you're applying for paramedic science, you might recognize that you need to be able to stay calm under pressure. You need to be able to communicate with people in difficult situations. You need to have really good timekeeping. You need to have really good team working skills. Then have a little think about which skills do you actually have and which do you need to work on maybe before you apply. So if you're like, I'm really, really good at sort of staying on top of my work, but I'm a bit rubbish at working in a team, how can you work on that? How can you develop that? And then most importantly, what can you do to evidence this? So if you have these certain skills, what have you done that sort of shows that? The skills can also be sort of that wider knowledge stuff. So it can be having knowledge of a particular career, of a particular course, of the NHS more generally. So some examples that you might have here, you might have communication skills, active listening skills, and the way you can prove that can be really, really diverse. It can be from that work experience or voluntary experience, it can be through your qualifications and sort of specific modules that you've done, specific areas that you're interested in, or it can be personal things in your life. So you might have taken care of family or friends, and that can show that you have really strong empathy or that you're able to sort of engage in patient care. Give you an example again for paramedic science. You might think, okay, I need to have really strong communication skills. I think I do have that, and I know I have that because I worked in a care home and I chat to people from really, really different backgrounds. I had to chat to current patients, other staff. Do I have really good organisation skills? Well, I was a St John's Ambulance cadet. I had to be really, really organised and on top of my work so that I could succeed in that role, and so on and so forth. The last one here I think is really important. Having knowledge of the role of the career that you want to go into is again really vital for any of our courses. And that reading books, just understanding accounts, can give you a really strong idea of, yes, I know what it's like to be a paramedic, at least to some extent, because I've been reading these books, because I've been understanding these accounts of what the role of a paramedic is within the NHS. What I'd recommend is actually writing this down. Whether you've already written your personal statement, haven't even started yet, or have already sort of submitted and you're getting ready for the interview, still try and write down what skills you think you need in the role, what skills you have, and how you can evidence it. Talk about this a little bit later on, but if you're able to do that, not only will you have a stronger personal statement, you'll also have a stronger interview, and you'll have a better understanding of what you're getting yourself into. Again, these courses can be difficult, they can be challenging. Lots of our students do sort of struggle at first, and they need a little bit of support. But if you can go into it knowing that you need to develop these skills, that you're maybe missing out certain parts of the role, it'll really help in hitting the ground running when you join George's or another university and just sort of understand exactly what you need to do before you start. One thing that I'd really, really recommend is having a bit of an idea of what have you done, what did you learn from it, and how does it link to the course. So again, if you've been volunteering, okay, describe your volunteering, whether it's in your personal statement or in the interview, describe what skills you got out of it, and have an idea of how that links to the course. If you have done an EPQ, that can be a really, really great way of sort of deepening your understanding of a subject. So maybe for biomed, deepens your understanding of a certain area of biomedical science. And it links the course really, really tightly. As you know, throughout the course, you're going to be looking at that area in a little bit more detail. Now, if you have already written down the skills you need, skills you have, and how you can prove it, then you've already written down your activities, what you benefited from it, and how it links to the course, because these things match really, really closely. So the how you can prove it is the activity, the skills you need is how it links to the course, and the skills you have is the benefit you got from the activity. That was quite a lot of information, and it was pretty quick just because we want to get on to sort of MMI's, interviews, and your questions at the end. But if anyone does need extra support with personal statements, do send us a question in the Q&A. We can go over that in a bit more detail, or there'll be a link at the end on how to get in touch with us if you do want that little bit more information. Next, I'm going to talk very, very briefly about MMIs at St George's. So as I said, MMIs are the main way that we interview. It's how we do all of our medicine interviews, and it's also how we do a lot of our healthcare interviews. And they're quite unique in a way. Lots of universities do them now, but it's not like an interview that you would typically see for a sort of job if you've applied for a job already, or if you've had a sort of panel interview or a phone interview. It's a little bit different. So all of our interviews are in person. And what will happen is you'll show up and you'll be directed towards what we call a station, basically a desk with maybe a couple of people who are your assessors. These could be academics, they could be clinicians, they can be other sort of members of the NHS staff, of the multidisciplinary team. They can be professional services staff like myself. So I assess some of the MMIs that we have. And the station will be focused on a really, really specific area. We'll go through the areas we use in a little bit. You spend between 4 and 5 minutes at each station, and normally have a minute or two rest afterwards to sort of recuperate. And they'll be asking you different questions on different topics at each station as you're physically moving around the room. We do this so that the assessors can really focus on a specific area and come to understand where people are strong and where people are maybe lacking some of those skills that we really need. It also means that you can sort of relax between each question. It's a new question with a new set of assessors who haven't heard from the previous set, and so you can go into sort of fresh-faced and ready to answer the next question. So the 6 stations that we run, this is all on our website, you can find it all out, but just sort of go through them in a little bit more detail. So firstly, we might have some sort of role-playing stations. This is where we'll have an actor basically pretending to have a conversation with you, normally a difficult conversation. They might be pretending to be a patient. They might be acting as sort of another member of the multidisciplinary team. And again, this is just to understand how you will assess this difficult conversation, how you'll have it in a sort of respectful and communicative way. Next, we'll have stations that ask you to consider ethical scenarios, and we're going to go through one of these in a second. But these are basically designed to see how you think. It's not that we're asking for the right or wrong answers in these situations. Instead, it's to get a bit of an idea of what you think about the situation, how you work through it, what sort of resources you use to consider it in a little bit more detail, especially thinking about NHS values. But again, it's not about necessarily getting to the right answer, but instead about the sort of process that you have in thinking through it. Sometimes we'll have a data task. So this can be a really, really short task just to see how you handle data presented in front of you. It won't be asking sort of science specific question, but instead, more generally, are you able to interpret a chart or a graph in a sort of situation where there's other people maybe talking to you and giving you some extra information. Some of the stations are reflective, so they'll ask you to think back through the various other stations, what went well, what didn't, and how you sort of improve on it in the future. Some of them look to assess your team working, communication, and leadership skills. So you'll be working with some other interviewees to put together maybe a short program or a process, and again, just seeing how you work with other people. And lastly, you might be given a clinical scenario, and this is basically to understand if you know what sort of role you're hoping to get into. So again, if you're thinking about going into diagnostic radiography, what's the role of a radiographer and how will you fit into the wider team in this sort of specific scenario that you're given. So one thing that we often ask MMIs is why do you want to enter the profession? Now, it can be difficult to think what we're sort of looking for, but the main thing is this is where you have a real opportunity to reflect on your experiences and show that you have the skills that work really well with your motivations. So maybe you really, really love science, but you also want to take on a leadership role. Maybe you like working in clinical environments, and you can prove that because you've had this relevant experience, you've done this online work experience because you've read these books. Again, we want you to demonstrate that you have a really strong understanding the various roles that you're getting into. So do you know what it's like to be a doctor in a hospital? Obviously, you're not going to be experts, but have you taken the time to read around the subjects so that you can understand what you're getting into? One thing that you really want to avoid in these questions is those sort of big cliches that I've wanted to study medicine ever since I was a baby. Not only is untrue, but everyone says it. Instead, again, try and talk about your concrete experiences that you've had and how these relate to the course and what benefits they gave you. So a slightly different example is this sort of ethical scenario. So should the NHS charge money for treating alcohol and smoking related illnesses? The really important thing here is that you are able to engage with both sides of the debate. You want to demonstrate that you have an understanding of the situation, of the topic at hand, and you can speak to both for and against with confidence, and that you can understand the opposing views. We would really encourage you to be open and approachable with the sort of side that maybe you disagree with. So maybe you think the NHS should charge money for this, but you want to make sure you understand why people wouldn't think that was the case. Bear in mind that, again, it's not really about the conclusion. We're not looking for someone to be like, yes, the NHS should charge money for this. Instead, it is about you understanding the various reasons for and against, and then sort of being able to talk through how you came to your conclusion. One thing it's really great to do here is include some relevant pillars of medical ethics. So is there something about autonomy in here, something about one of the other pillars? But don't just sort of talk about that for the sake of it. You want to make sure it actually links to what you're talking about, to the argument that you're making. There's no point just sort of listing them for the sake of it. That won't get you any points. Instead, being able to actually use that information, show that you've understood what the pillars of ethics are, and you understand how it might relate to this topic. Again, that'll be really, really effective. One thing that is important in these questions, although we're not looking for a right answer, that doesn't mean that there aren't things that might not be true or might sort of put someone off when you're answering the question. So if, when answering this question, you don't recognise that alcohol and smoking related illnesses are linked to addiction, and addiction is itself an illness that the NHS attempts to treat, if you start talking about it being like purely self-inflicted, that might harm your case, because again, you haven't really understood the topic or how the NHS would generally promote it. This doesn't mean that if you think those things, that it would necessarily mean that you would never get in. But again, you've got to sort of approach it as a doctor working within a wider healthcare system and how that would sort of be most effective. Okay, so that was a lot of information, a lot of talking from me. We've got 20 minutes left, give or take, and so I'm really, really keen to start to hear from some of our students. So I'm going to stop sharing my screen. If John and Vicky, you're happy to turn your cameras on. Do you both want to like very quickly reintroduce yourselves, just because I feel like people have got loads of info?
So I'm John. I'm currently a two-year medic again, and I did my previous degree here at George's in biomedical sciences.
And I'm Vicky. I'm a fourth-year medic at George's, and I did a biomedical science degree at University of Hertfordshire.
Nice, cool. So we had a couple of questions submitted beforehand, so whilst people are putting in the ones from today, maybe we can go through those. So I guess the first one is just, why did you decide to study biomed and then I guess move to medicine, and why specifically at St. George's? Vicky, do you want to go first?
Okay, so it's a very interesting answer to my question. So I always wanted to study medicine. I knew this when I was 11. Why I decided to do biomed, just to keep it short, I didn't get into medicine initially, my A levels, and I learned on my first ever medical experience shadowing a colorectal surgeon at George's, funny enough, that biomedical science or other degrees is an alternative route. So as a graduate, so that's exactly what I did. I didn't get in doing A levels, so I did 3 years of biomed and then applied. My journey took 4 applications. Then eventually I joined. I got into med school, so that was my why. I didn't really want to do biomed, but it was my access to medicine because there was literally no other way I saw to do it. Yeah.
For me, it was a little bit different. So I applied because I wanted to do biomed. I knew going in, I wanted to do like biology, but within the medical field. But I just didn't know if I wanted to do like in the hospital or in research. But because the biomed course at St. George's was very clinical heavy, I would say, it sort of influenced me to say, oh, I really like the more clinical part of biomedical sciences. So that's why I went for medicine afterwards.
Oh. So the next question, I guess, just because we've talked a bit about the application process in a bit more detail, how was the application process for both of you? Obviously, it was a little bit different than maybe people applying straight for undergrad, but what was like maybe the most difficult part of the application process for each of you? John, do you want to go first this time?
Yeah, so I think the most difficult was probably the preparation for the MMIs, because it's a completely new thing that you do when you're applying to university. You don't really have much experience. But if I were to give any tips for that, I would say practice as much as you can. It doesn't have to be like practice with a doctor or practice with a professional. Just practice with your mom, your sister, whatever. And by the time you get into the interview, you'll be very comfortable in talking about a subject for so long. So, yeah.
What about you, Vicky? Similar?
And for me, I'll say like the most difficult part was just even trying to get in and my application process. Like I told you, it took 4 tries. And once, my opportunity came, everything was very like quick. So when it came to prepping for interviews, because I got in through clearing as well. So I had to redo my UKCAT and prep for interviews, and all of that happened in a short space of time. But similar to like John, when it comes to like preparation, you may never be fully prepared. You might hear this cliche thing, but do the best you can. As far as like UKCAT, that's just practicing, doing a lot of questions, and there's no like rule. You have to do certain things certain way. Like it's literally just practice. So with interviews, it's nice to, online. There's always resources, Medic Portal. There's several resources that we can share with you after as well, that you can go on and find out how to prepare for interviews. They don't always involve payment. Some people pay to have these courses. You can always do good preparation without payment as well. Just learning the ropes of things, how to answer questions, and learning about medicine as a whole. So just practice, I'd say.
Oh. So I guess the last one that we maybe had prepped beforehand before we take the sort of live questions is a little bit more about the interview experience. So obviously you both had quite different interviews, being through clearing and not. But did it sort of match, I guess, what I said about MMIs, or was it a little bit different in your experience? And Vicky, you can go
Yeah.
first.
It was actually to a T. So it's like a combination of finding about you, as an individual, and what you can bring to the table, as in like what you can contribute to medicine. And like with one of your examples, for instance, when it came to like medical ethics, they really want to see, for instance, you being able to weigh and compare, because with medicine, things aren't always black and white. Like you actually need to weigh out the risks and the benefits of like a medical procedure or medications. So, it's you shouldn't just go straight into the answer, a question answering, no, I'll do this. You need to like have a balanced argument of why you would, favor one thing over the other. And with tea working, and for instance, they can ask you to explain a time where you showed great teamwork, great leadership. So you guys might be familiar with the STAR method, or Jack said ABC. So you really want to use those structures, and it helps you better to answer the question as well. So you're not missing things out, and it makes your answer seem more clear. So what Jack said exactly how my interviews were.
Nice. What about you, John?
Yeah, I would completely agree. What Jack said was pretty much accurate. So when it comes with George's, I think what they particularly like is actually really good bedside manner, or just being able to communicate well with whoever you are in the profession that you're going into. And so if I were to give advice about how you would proceed about doing your interview, I would say really work on just knowing how to talk in a way that feels natural. Because I know in an interview you'll be all nervous and everything, but just being able to sit there and talk about yourself, what your experiences and how you reflected on that, that's really big, and I think scores quite high for interviews.
Nice. Thank you. Um, we have a couple of questions coming through now. So the first one, I guess, a little bit more about the university experience at St. George's and how it might be a little bit different because we are sort of smaller and only focus on healthcare, medicine, and science subjects. So has that been your experience? Do you think it's different than maybe your friends that went to other universities, or for you, Vicky, compared to your previous university? And sort of adding to that, is it quite a small and close-knit cohort for medicine in particular?
Oh, I'm going first, or?
Yeah,
Okay.
either or.
Yeah, so like I told you, I did my undergrad, like my biomed in Hertfordshire. That was like almost 40,000 students compared to George's, which is
Yeah.
just over 5,000. So the difference was huge. And on top of that, I started in COVID. So this was 2020, was lockdown. Everyone was very locked in, things were online, lectures online. So with that, people kind of got close pretty quickly. And just being a small university in general, like you get to meet a lot of people from different healthcare courses, even if they're not studying the same course as you all have similar interests in that it is healthcare. um, it's the same thing with other universities where you can network, meet people, participate in sports and societies. It's just smaller. Like that's literally it. The only thing is that you may not meet people that study in English or history or other courses, but it doesn't take away the ability to connect and meet new people and build friendships and network over time. So I've been able to do that. What, 4+ years in. So yeah.
Nice. What
Yeah.
about you, John? Similar for you?
So for me, I think that was one of the factors going into like first applying into St. George's, because I was kind of iffy about, oh, it's a small university, I'm not going to get as much exposure to other students and whatnot. But what you quickly find is that because it's a smaller university, there's more of a community feel. So for example, when it comes to asking older years for help, that's really easy to do because you would probably see them in the hallways very often. Even making friends is relatively easy because it's a small university. You're more likely to see them. So I personally like the whole close knit feel. In terms of like collaborations with like other universities. I know for a fact that a lot of our societies also do like collaborations with other universities that don't do anything to do with healthcare. So, for example, I know last year for the Asian Society, we had a collaboration with UAL, for example, which is a fashion school. So yeah, we do. It is initially quite small, but then we do also have other collaborations with other universities.
Oh, thank you both. So we've had some questions that come through, maybe again thinking a little bit more about your applications. Did you guys do any sort of like wider reading when you applied? Thinking both, I guess, for biomed and for medicine in particular. And do you have any recommendations? I'm putting you on the spot a little bit. Doesn't need to be like a specific book, but like, did you do sort of wider reading or anything?
So for me, when I was getting prepared for the MMI interviews, in terms of like recent topics, there's this resource. I don't know if it's still there, but it was a sort of like resource that Medic Portal, I think, which had all of these sort of recent topics that were coming up and common things that might be asked on interview, and I thought that was very useful for helping me know what was going on in the world, I guess.
Yeah. And for me, it was a wealth of resources because my journey actually started like over 10 years ago. So it was a while, but at the time, the resources I did use then still favored me. So, like, for example, if the CAT, which used to be UK CAT, they have an online site where they have practice questions, and there's this UK CAT book, 2,500 questions that you can go on Amazon. Besides this, the Medic Portal, like John mentioned, as well as Medify, they had so many resources, which also included personal statement examples. So you can actually look at people's successful personal statements and, not to obviously, plagiarize and copy exactly what they did, but just to give you an idea of what a good personal statement looks like. And just even watching YouTube videos of people sharing their experiences of getting in, because it can be very reassuring. Like, not everyone has the conventional journey getting in after A levels. So it's nice to hear other people's experiences and how their journey was like. And it can encourage you as well when you're pursuing medicine.
Oh, that's really, really good to know from both of you. There's a couple of sort of quicker questions that I can address quickly. But if anyone does have sort of wider questions for ambassadors, do put them in and we'll sort of address them before we wrap up in 10 minutes. So a couple of people have been asking about BTECs, about access to HE courses, and a few other things. Generally, we do want to take any sort of subjects people have studied that we think are relevant. On our website, you'll see a big list of everything we'll take for each sort of course, so do have a little look for your specific subject. Sorry, I can't go through them in detail. Similarly, people have been asking about international qualifications and GCSEs. So if someone studied internationally and they didn't have a chance to GCSEs, we wouldn't require it, as long as you've got sort of equivalent or a higher qualification that can sort of prove that you're still up to that level. A couple people have been asking a little bit about some other requirements we have. So for example, do you need to be able to drive? I assume that's specifically for paramedics. For our course, you don't need to be able to drive when you start on the course, and we can sort of support in making sure that you're able to do that by the time that you graduate. Because yeah, to be a paramedic in the UK, generally you need a driver's license, but to apply for our course, you don't have to. A couple people have been asking specifically about graduate entry. So graduate entry medicine is a little bit different. Generally, you'll set the GAMSAT rather than the UCAT, which can be slightly different. One thing that's worth noting is if you're a graduate, you can apply for undergraduate, so that's a 5-year course, or graduate, that's the 4-year course. And you'll set the UCAT for the 5-year, the GAMSAT for the 4-year. So depending on what you're applying for, just make sure you set the sort of right admissions test because you're not able to apply it without it. Some people have asked for a UCAT cutoff. So we set the UCAT cutoff after people have applied. That's so that we can maximize the number of interviews that we take. Last year for home students, it was 2,690. For overseas students, it was 2,700, so just a little bit higher. We won't set the UCAT cutoff until after the deadline. And again, that's because we want to interview as many people as possible. Generally, if you qualify for our courses and you're above our UCAT cutoff, we will interview you. Only in very exceptional circumstances would we not. So generally, if you sort of get a decent UCAT score and you're predicted the right grades or you already have them, then you will get an MMI for medicine. That's really, really good to know if you're thinking about applying. You know what your UCAT is and you can see our historical UCAT on our website. So you'll be able to find out if you've got a really good chance of getting an MMI. Someone has asked a little bit about sort of how we split up shortlisting UCAT scores, situation judgment test, GCSEs, personal statement, and how we weigh all of these things. So prior to the interview, all we're really looking at is, are you eligible for the course? Sort of more generally, have you sat the right subjects? Are you predicted the right grades? And did you get a high enough UCAT? We won't look at your situational judgment. We won't look at your GCSEs beyond our minimum requirements. After the interview, that's when we start weighing things more generally. We don't have a specific weight that we put to the interview and put to the situational judgment and put to your GCSE, partly because these things can offset each other. So if you did, let's say, badly in your situational judgment test and the UCAT, but you did great in the interview, those things can offset one another. So we're not going to weight them specifically. Instead, we sort of understand it holistically, but that's after the interview. So before the interview, we're only really looking at your UCAT and that you've got the minimum GCSE requirements and you're predicted the minimum A level or equivalent. And I think those were most of the sort of short questions I can answer. A couple of people have asked for like our admission statistics. I won't run through that in detail, but it's on our website. If you look up St. George's admission statistics, you can see how many people applied for each course, and how many got an interview, and how many got a place in the end. I'm just trying to have a look there to see if anyone else has asked sort of question for our ambassadors. People have asked about open days. I'm going to put that up at the end. We have one at the end of the month. We'll also have one in the summer. Did you guys do sort of work experience? I know, Vicky, you mentioned it before, and that you did a little bit of shadowing. What about you, John? Did you do some work experience before applying?
So before I was a medical secretary at a GP surgery. So I did already have a little bit of a background in the medical field. But even if it wasn't like medical work experience, I think you could talk about whatever really, in terms of like, for example, if you work within, I don't know, in McDonald's or something, you can talk about problem solving skills in helping a customer who is a little bit difficult. So yeah.
Yeah, what about you, Vicky?
Yeah, so beyond, my first experience at George's here, again, like you don't have to, go all out. But me at the time, I just wanted to keep my, passion for medicine alive. So I did an overseas experience, actually 2 weeks in the Dominican Republic with a company that doesn't exist anymore, but it's called Gap Medics. So I had that, and then besides that, I actually did volunteering at Great Ormond Street. I've been doing it for the past 7 years now. So that, allows me, because I'm interested in pediatrics, allows me to, see children, work alongside them, and, gain some experience there. So the experience doesn't even have to stop, once you get into medicine. You can actually still stay connected, whether volunteering in the hospice or doing, some, London Ambulance Service, for instance. I have a friend that works with them. So, and again, like at the end of the day, if you didn't have like exact medical related work experience, whatever experience you have, you still have to be able to tie in. Did communication, you teamwork, you showed empathy. There's a lot of roles that you're able to demonstrate that in. So yeah, you can still use those for interviews as well.
Nice. Someone's just asked about intercalation. Did either of you think about intercalating or consider that? I guess why or why not, and what were the options for you to intercalate?
I didn't have the option to integrate because I came in differently. But Vicky, did you have that?
Right. So usually with medicine, after third year, people can do an intercalation before coming back in fourth year. I decided not to because, one, I already am holding a biomed degree, and two, there's nothing of my interest to intercalate in. If you have any particular interest, you're welcome to do an intercalation. Like typically after third year, it's done then. But yes, no, not by force. Like, yeah. Up to you.
So I think that's most of the questions covered. I know a couple of people have put sort of more specific things in the chat, and hopefully we'll be able to sort of go for that. Afterwards, we can sort of follow up with individual people. Were there any sort of final things that you would give to a tip to someone thinking about applying to St. George's, or just thinking about applying for like medicine or healthcare in general? Putting you on the spot a little bit, but
For me, I'll just say, there might be some people on here that have been discouraged, whether it's from family, friends, or teachers, not seeing, your abilities. I'll say don't give in to that. If you know medicine's your true passion, pursue it. Only you can say, when you no longer want to pursue something. For me, it took a long time, but it's something I knew I wanted to do, so I kept on going. And it's good to have like a support system around you, like having people to encourage you on your journey, because it's not easy. It has difficult moments, difficult times, and life does happen as well. But if it's your genuine passion, just keep going, stay motivated, and keep trying your best. And some people say, oh, I'm going to be old, blah, blah, blah. I mean, for instance, you're going to reach 30 anyway. Why not do that, pursuing your passion? And don't come to medicine if you're coming in for money, because, yeah. it's not yeah. It's not a real, goal to do that. But yeah, have passion for anything, not even just medicine, anything.
I think any last tips for me is talk to as many people who are going into whatever you want to do. So for me, I talked to a lot of like medical students. I've talked to a lot of junior doctors before actually going into medicine because I just wanted to know what it's actually like. You can say whatever on the leaflet, but their personal experiences would sort of shaped how I thought medicine would be, and I think that was more interesting for me and for the career I wanted to go into. So.
Nice. Okay, thank you both so much. I think that was really, really good advice and sort of some top tips to hear a little bit about your experience. And the last thing I'm going to do before we sort of finish up is to tell you about some upcoming events that we have. So on the 26th of October, we have an undergraduate open morning. This is for all of our courses apart from medicine. So for medicine, we're going to have a bigger event in the summer because it's after the medicine deadline for this year. That won't be represented. But for anything else that you're interested in, so healthcare science, I saw some people, paramedic, diagnostic, radiotherapy, that'll all be there. It's running from 10 to 1 on the 26th. So please do try and come along. You can sign up at this link here, or if you go on our website, it should be right at the front. We also have a bunch of other webinars that are more focused on sort of the specific subjects. These are delivered by the course teams in particular. So instead of being me or the admissions team, it's by like the people that actually teach you the course. You can see the dates for all of these coming up. But again, go on that link on our website and you'll see them all listed there. You can click through it and register for those events, hopefully soon, if not already, and learn a little bit more about them there. Otherwise, please do get in touch with us if there are any follow-up questions that we didn't quite get to. So the email that you need to get in touch with is just study@sgul.ac.uk, and that'll be our course inquiries team who can sort of support with any specific questions that you might have, and whether it's about medicine, healthcare, Georges in general, or sort of wider how to apply to university. Otherwise, thank you all so much for joining today. Hopefully it's been a really, really useful event. Hopefully you've learned something about Georges and about how to apply to university for healthcare, medicine and science courses more generally. Thank you again to our two student ambassadors that joined us today. I always think they do a much better job than me actually explaining what it's like and giving you some advice. Otherwise, hopefully see you all soon at an open event or when you apply soon. Thanks everyone.